Okay, so today I'm going to go over ICD-9-CM format and conventions. And I think the reason I'm doing that, I'm just going to start right from square one because I think that people are still kind of struggling with that. And if you can get the conventions and the guidelines down and really understand that format, you are going to be fine when it comes to coding. And again, don't get frustrated if you're not getting it, because I'm telling you, it's just going to one day just snap and you're going to get it. I promise you. All right, so format, ICD-9 format. There are 3 volumes, right? Volume 1 is the tabular list of diseases and injuries, and that's right smack in the middle. Volume 2, we've talked about this, is the alphabetic index of diseases and injuries, and that's in the beginning of the book. And why, I don't know, but they didn't ask me. So that's just the way it is. And volume 3, which is the tabular list and the alphabetic index for procedures. So the volumes 1 and 2 are put together when it comes to diseases. All right. There are some books that are published with only volumes 1 and 2, not volume 3. Those are for physicians to use in their offices because they don't use the procedures information. Volume 3 is for hospital use only. When it comes to procedures, physicians use CPT and HCPCS codes. And that's something that you'll be learning about in HIT 105 with Michelle. Some versions of books will have reimbursement edits. They'll have color-coded information. They'll be real pretty like your book. They'll have MSDRG alerts. They'll have age edits, they'll have sex edits, and what we mean by those things are they will be little notes that they have throughout the tabular list saying, hey, hello, you can't use this, you can't code a hysterectomy on a man, so make sure if your patient is a man that you're not using this code because it's not eligible for use with a male. There will be some disease processes or procedures that are age associated. So they'll say, hello, you can't have this at this age. All right, so you watch for those things. Some books will also have coding clinic references, and our book does. And we've talked a little bit about coding clinic and to pay attention to those things in your textbook, but it will also have coding clinic references in your code book. Now, we will talk more about those and how to use those when we get into utilizing the encoder, which will be, I believe we do that week 9 or 10. All right, because we want to get you using that encoder to understand it. All right. You'll find books come in all different shapes and sizes. They have some that are 3-ring binders where you can actually pull out pages and you get an update packet and you have to, it tells you replace this page with this page and pull this out and add this page in between here and all kinds of good stuff. That's just so you don't have to continue buying a new book every so often and you're always updated. Okay. Every book has information at the beginning to explain it. So every book has that section where it talks about the guidelines. Most books have a section that have some type of anatomy, plates and pictures. Some books have information explaining how to use the code book. It just depends. So what I want you to do is really take a good look at your code book and see, you know, what do we have there available to you? What information is available to you? Because I'm telling you, it's absolutely invaluable information. Okay? So ICD-9 is divided into 17 chapters. Okay? Those chapters are then divided into sections, categories, subcategories, and subclassifications. So let's talk about this. Sections. What are sections? They are the 3-digit, they're a group of 3-digit categories that represent a similar disease process or a condition. So that will be a range of 3-digit codes. It will be a range of, it might say, and this is just off the top of my head, so don't go looking for this, but it might say 250 to 275. those would, in theory, be divided, and they're not, so don't go looking at that and trying to hold me to it, but it's just an example of what a section is. It's a group of diseases that kind of are all the same. You know, one of these things is not like the other. They're a group. Think back to your Sesame Street days, okay? Categories are one single 3-digit code that describes one disease process or condition. All right, so the section is a group of 3-digit codes. The categories are one. All right, a subcategory is a 4th-digit code that provides even more specificity. So you've got your 3 digits from your category, and then that category can be broken down into subcategories. Those subcategories are going to be the 3 digits, a decimal point, and a 4th digit. All right. Then a subclassification is a 5th digit that provides even more specificity. So it's going to be the 3-digit characters, decimal point, and then 2 digits. All right, that's your subclassification. Okay. Then we also have something called a block. That's a 3-digit category that represents a disease process. You know, we don't really use a lot of blocks, but what we really use, I want you to focus on the section, the category, the subcategory, and the subclassification, along with the chapters. All right, that's what I want you to really understand. So if we look at this, okay, so let's look at this. So right here, we have a section, other diseases of urinary system. 590 to 599. That means if you open up your code book and look at 590 and all those 3-digit categories that are under that between 590 and 599, they are all going to be related to the urinary system in some way, shape, or form. Okay? Then we have the category. So here's your category. 590, infections of the kidney. Okay? Then we have a subcategory, which is right here, 590.0. There's our 4th digit. That is chronic pyelonephritis. So we're getting more specific, right? Infections of the kidney, pyelonephritis. Okay? Then we're going to move to a subclassification, which is 590.00, without lesion of renal medullary necrosis. Okay? So what we truly have is, yep, they've got an infection of the kidney. Oh, that infection is actually chronic pyelonephritis as opposed to acute pyelonephritis or renal and perinephric abscess or pyelouritis cystica. So those are all subcategories, right? Here, 590.00, without lesion of renal medullary necrosis, is a subclassification because this chronic pyelonephritis can be divided into 2 possibilities, with a lesion and without a lesion. Okay? All right? ICD-9 supplementary classifications. There are 2 supplementary classifications that we have that are sort of like, they're special codes. Okay, these are special codes that they're V codes, which the actual title is Supplementary Classification of Factors Influencing Health Status and Contact with Health Service, and E codes, which is Supplementary Classification of External Causes of Injury and Poisoning. So if you just remember E for external, you're good to go. Okay, so take a look in your code book, look at the V codes, look at the E codes, just kind of give yourself an idea of what's there, what kinds of things are there, right? Okay, so let's talk about the format of the alphabetic index. The alphabetic index has 3 sections. The first section is the index to diseases and injuries. That's all the big section, okay? Then we have a table of drugs and chemicals. That's where you're going to find any type of drug, any type of chemical that you can think of. All right, bleach, antibiotics, paint, any type of chemicals that you can find there, you will find or that you're looking for, you'll find there, okay? Alphabetic index to external causes of injury and poisoning, that's our E codes, right? Okay? So, then we have two tables that are also in the index. We have the hypertension table and we have the neoplasm table. And we will be discussing those further when we get into coding and when we get into, you know, as we move through the textbook. We'll delve into those a little more deeply. All right? So, there are 3 levels of indentation that we use in the alphabetic index. We have main terms. So let's look at this. Here's our main term, cholelithiasis, right? It's all the way over here, right? Flush with the margin on the left, and it's always bold. It's always going to be bolded, okay? Then we have our subterms. Those connecting subterms, they indicate a relationship between the main term and the subterm. So for example, with and without, associated with, due to, in, with mention of. Those are the kinds of things that you're going to find. So let's look at this. So we have cholelithiasis. And then if you were to take a ruler and follow this straight down, what do we have? Oh, here we have with, but look, it's indented. Do you see that? This is considered a connecting term. It is connecting cholelithiasis with the cholecystitis. All right? You may see without. You may see it say due to, in, associated with. All right? Those are the types of things you're going to see. Okay? Carryover lines. This is a carryover line. Well, we don't really have a good example of a carryover line here, but what we do have is an example of further subterm indentation. So, if we were looking at cholelithiasis with acute cholecystitis, what are we going to do? Well, here is our cholelithiasis. We know that because it's the main term. It's bolded, and it's flush with the left margin. Then we have, if we follow down, and what you can do is get yourself an index card if you need to, and hold it so that the edge of the card is like this. And you will be able to see, oh, there's with. And then if you hold it here, you can see with, this is also indented, right? So we have cholelithiasis with cholecystitis. Now, what you need to do is, the reason I would hold that index card here is because if there is any further indentation, you've got to keep going. And I tell people to think of it as skiing down a hill when you go skiing. Now, I've really never been the kind to go downhill skiing. I'm the kind to stay behind and look really cute in my ski bunny outfit and drink the hot toddy by the fireplace. But that's just me. However, if you were skiing down a hill, would you want to stop smack in the middle of the hill? No, you're going to want to keep going. So if you look at this, we have cholelithiasis with cholecystitis. Look at that, we have more acute and chronic to choose from. Okay? Sometimes when you're first starting to code and all those little words and that little tiny print kind of all blurs together, and that might be helpful for you to do that. Okay? Let's go back to that. Sorry about that. So at this stage, we know that we have to go further. There's more specificity there, acute or chronic. That's a big difference, whether it's acute cholecystitis or chronic. That's huge. That's huge. So it's important that you continue to go, okay? A carryover line would be one that if you have a lot of words here, that it would carry over to the next line underneath. That's all that is, okay? All right, so that's our format, okay? Let's talk about conventions. Actually, you know what? I'm going to divide this up. I'm going to do I'm going to stop there so that you've got the format, and then I'm going to do another one for coding conventions. All right? All right. See you in a minute.